Since late June, more than 3,500 Victorian healthcare workers have been infected with the COVID-19 virus. More than 1,700 of those worked in aged care and nearly 1,100 in hospitals.
If there's that level of staff being infected, it really is a big warning sign about the system and how well it's performing.
Any infection or illness to our staff is a huge issue for us, and I'm personally very upset about it and concerned about it.
I didn't need to be told that I had it because I was full-blown shortness of breath, shivers, shakes.
Melbourne radiographer Bruno Trelia was working at Melbourne's Austin Hospital in July, x-raying sick patients when he tested positive.
It was like no illness I've ever had. It was just unrelenting. I could not get a breath in.
In August, the Victorian government tried to argue that most hospital workers were infected at home or in the community.
The majority of healthcare workers are acquiring coronavirus outside of the workplace.
2 weeks later, State Health Department research showed that almost 7 out of 10 infections most likely occurred at work.
Arguably, that is one of the highest incidences of occupational illness and disease that we have seen in this country for more than a decade. So that tells us that we did something wrong and that we need to learn from it.
Kate Cole sits on a Victorian task force set up following the state's second wave. Kate has worked in occupational safety in many potentially dangerous industries, including mining and construction.
When I look at healthcare as a sector, I feel as though it's at least 15 to 20 years behind in terms of workplace health and safety.
After initially being given a high protection respirator mask, Bruno Trelia says he was later told to use a surgical mask instead.
At the time, we were following along the process of best practice. You put your faith in the people who are whose job it is to look at those things and to make those decisions.
Do you regret the decision to having moved to surgical masks from N95 at the Austin?
I think we were following the policies and procedures given to us by the Department of Health. So I definitely don't regret following procedures that the experts give us to do.
Bruno Trelia spent a week in intensive care, where his greatest fear was having to be intubated. Mainly
because I still have a young family. What are the implications if I don't survive? What are the implications if I survive but I'm drastically affected?
The concern of healthcare workers is that cases like Bruno's may have been avoided had respirator masks, properly fitted, been available. There were also concerns early on about a shortage of high protection masks.
Certainly mask conservation or at least ensuring that we had enough mask supply was at the forefront. We wanted to make sure we never in a situation where we ran out of masks for ourselves or healthcare workers.
90% of our members had concerns about their safety. I've heard a lot of people who've wanted to speak up and who've been scared to, or people who have spoken up and haven't felt that their concerns were acted upon.
One way to show you've listened to healthcare workers is to give them one of these. They need to be fit tested to ensure there are no leaks. And yet even now, fit testing is still not routinely done across Australian public hospitals.
There wasn't any fit testing. Essentially, you had to use what was available to you there at the time, and it was either that or nothing. Across the board N95s and across the board full face shields certainly would have made a difference to me and would have prevented my getting COVID.
So how do you explain 1,000 infections, more than 1,000 infections in Victorian public hospitals?
So we've learnt a lot about the outbreaks in the second wave. What happened and what we learned, and we're still learning about, is that the aged care patients were transferred into our hospital, and those patients, when they were held together in groups and where there was what we call aerosol generating behaviours, which was wandering around and calling out and coughing and on people and so forth, that did increase the risk.
One reason why there's been mixed messages about masks is that the infection control expert group that advises National Cabinet plays down airborne spread as an infection risk.
I think the fact that we've now had 3,500 health workers infected, 70-80% of them likely to have acquired it in the workplace, and we're still debating that, I find just very frustrating.
They haven't had the benefit of a safe workplace like other Australian workers do in other high-risk industries. No matter what industry you work in Australia, when you go to work, you should be protected.
We recently strengthened our language in Victoria relating to the potential or the evidence of airborne transmission, but I think it's fair to say there's controversy and difficulty in the literature about how important it is, but we're taking a view that to be cautious about it and have a precautionary approach to it.
Bruno's son caught COVID too, almost certainly from his father while he was asymptomatic. His son has done well. Bruno, though, is taking longer to recover.
I fool myself into believing that I'm back to normal. The slow climb out and back to normality, that's the most frustrating part. The public hospital sector has had to really review and look at their practices and to step up.
You really have to worry about the extent to which we can trust the system. And there's a real job to regain trust and make sure everybody's working concertedly for care to be safer and of high quality.
We need to learn from it and improve drastically to prepare ourselves in case there is a third wave, because we can't just do the same thing and expect different results.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.